will be focusing, our group will be focusing on the improvements of cranioplasty. This is needed because most commonly this procedure is performed on patients who have suffered a traumatic brain injury. And one of the most common issues are surgical site infections. And this can lead to more hospital stay as well as more surgery to deal with infection. This method focuses towards the patients and the doctors who will benefit from the new approach. On the side of patients, they'll have less doctor visits and hospital time, as well as the procedure will improve post-operative neurological recovery. And for the doctors, they will get better patient outcomes.
So our new approach focuses on creating a material and surgical strategy that will help reduce the risk of infection from cranioplasty. One major problem with the current approach is the lack of bone ingrowth promotion at the site of the implant. And our goal is to increase surface interactions of the material to provide greater support for tissue adhesion and for development and new bone growth at the implant site. This will be done primarily by increasing the porosity of the implant material and by using sort of a mosaic tiled design of the implant materials, as you can see in the image at the top of this slide, to leave small spaces that will hopefully allow for new bone ingrowth. Additionally, our plan includes an antibacterial coating of the PEEK material used for the implant to fight any potential post-operative infection that may start to develop. And we're also proposing a new fixation method for the implant, which focuses on increasing the number of fixation sites, using 5 or 6 different attachment sites rather than just 1 or 2, and using a titanium mesh as a part of the fixation method rather than just surgical screws by themselves. These changes should also help to improve tissue adhesion and promote bone growth.
So from this picture, we can see most of the material have relatively similar average infection rates comparing to the autologous bone and hand-formed PMMA. And the PEEK is one of the most commonly used, and that's why we're choosing PEEK as our main material. So as for the benefits per cost, based on our research, our design will cost relatively similar with the autologous implants, but it will have much less operation time than autologous transplants, and they will have also significantly reduced the operation time. At the same time, the hydrophilus complication happens a really high ratio, can significantly the chance of this can reduce because of the less operation time. And furthermore, it can reduce infection rates and ICU admission needs. Combine all of this, we can ensure our implant will increase the survival rate and the patient's life quality.
Our competition is the 5 most commonly used materials. PEEK is the gold standard of the current materials. It is a tough and durable material similar to cortical bone, and it allows for patient-specific customization. However, it does not support soft tissue adhesion. Similar to PEEK, PEG is a 3D printed variant with the addition of pores in the implant which allow for minor osseointegration. However, it does not support soft tissue adhesion, and the spores have been found to be a sterilization risk. PMMA is a durable material mostly used for extensive customization. It is crack resistant against burr holes, but it traps air bubbles when manufactured, which can lead to infections. Porous polyethylene is a cost-effective material that allows for use in multiple defects. However, compared to other materials, it is soft and susceptible to cracking when titanium screws are added. And finally, titanium mesh is the hardest material available and is used in combination with bone cement and hydroxyapatite. It allows for osseointegration in patients, but it can leave patterns on patient's skin and contain sharp edges, while bone cement requires curing during the OR and can turn brittle over time.
Thank you so much. Do you have any questions?